Hello, everybody. I hope everybody can hear me okay. We are just about to get started for this webinar tonight on Botox for the treatment of overactive bladder. I'm just going to give about one more minute before we start, just to get anybody else, last minute people who want to join, give them a chance to join. I did make sure to clean the spinach out of my teeth tonight. I don't normally have to do that anymore since we're usually wearing masks, but I figured you might be able to see my teeth. So, so I flossed. All right. Okay. It's 7 o'clock. Let me go back here. All right. So thank you for joining me again. We're talking about the treatment of overactive bladder with Botox. So the objectives of the podcast tonight is to first do a review of the definition of overactive bladder. If you have overactive bladder, you probably don't need me to review this, but we'll just go over that so everybody knows exactly what condition we are treating here with Botox. And then we're going to discuss Botox as a treatment for overactive bladder, including the indications, the procedure itself, what we're actually doing, and any potential side effects. I do also have some emailed questions to me that I will review at the end of the webinar. So I have those printed out right here. So if you emailed me questions, we will review those at the end. So starting with overactive bladder. Overactive bladder is an extremely common condition. I personally think everybody has overactive bladder, but that's because everybody comes to see me for overactive bladder. But it does affect about 33 million Americans and about 40% of women in the United States. So it is extremely common. So what is overactive bladder? It really refers to a group of urinary symptoms, and you don't have to have all of the symptoms to be diagnosed with overactive bladder. You can have 1, 2, 3 combination of symptoms. So some people have, for example, urgent need to urinate, or they urinate frequently. Other people can't hold their urine when an urge hits. Other people get up frequently at night to go to the bathroom. All of those symptoms are part of overactive bladder. And like I said, you don't have to have all of those symptoms to be diagnosed with overactive bladder. So unfortunately, many people with overactive bladder don't talk to their doctor about it. A lot of people are embarrassed. One of my big pushes right now in my practice is trying to educate patients and educate the community as a whole, because I feel like people don't often talk about this condition and people are suffering from it. The other reason that people don't talk to their doctor about it is that sometimes people don't realize that their symptoms can be treated, or a lot of people don't even know that a urogynecologist is a thing. They don't even know that the type of doctor that I am exists. So we're out there, and this is pretty much what I spend most of my days doing, is treating women with overactive bladder. So why is it important to treat overactive bladder? Overactive bladder can really impact your life. It may result in many trips to the bathroom throughout the day and the night. It can interfere with your ability to work, exercise, socialize, and sleep. And with that, it can put strain on your relationships with your friends and your loved ones. Some people may avoid parties and activities out of embarrassment. I think most people are avoiding parties right now because of COVID, but with that said, a lot of people don't want to go out and about when they have overactive bladder and they're worried they're going to leak. Even people don't want to go to the grocery store because they're worried they're going to leak or have an accident in public. But even if you're stuck at home with COVID and you have overactive bladder and urge incontinence, it can be a problem because if you're wearing wet undergarments or you have pads on that are getting wet, it can cause skin problems and infections, just be overall uncomfortable. So this is just a little flow diagram of this from the start to the finish with the options that we have to treat overactive bladder. First of all, we have to make a diagnosis. So you need to undergo an evaluation by a urogynecologist or urologist or your primary care doctor. If you are not ready yet, or you're early in your struggles with overactive bladder, you may not want to take medications or do any advanced therapies. So we also can offer patients conservative treatments like pelvic floor exercises, bladder training, that means timed voidings, and behavioral modification like avoiding caffeinated beverages. Now, as far as pelvic floor exercises go, these basically involve strengthening the pelvic floor muscles or Kegel exercises. And we do have handouts that we give patients to so that they can do these at home on their own. But I often recommend people have formal pelvic floor physical therapy either in our office or with one of the trained pelvic floor physical therapists in the area. Because sometimes even when people think they're using the right they're using the Kegel muscles, they're actually using their buttocks or the abdomen or their thighs. And when we want to make sure you're using the right muscles. So that's something that I'm a big proponent of. The strengthening your pelvic floor, even if you end up going into advanced therapies like Botox or InterStim, if that one urge gets away from you, if you can squeeze your pelvic floor muscles, you can get that urge to stop, but you have to have the strength and you have to be doing them properly. So that's an important part. Conservative treatments do have an important part, even as we go into the advanced therapies. The next phase is medications. I'm not a huge fan of medications for the treatment of overactive bladder for a number of reasons. One is that patients often are on a whole slew of medications and they don't want to add yet another medication to their list. Another reason is that these medications, particularly the anticholinergics, which are all of these medications listed here before you get to Myrbetriq, all of these medications can cause dry eyes, dry mouth, and constipation. Now, they don't do that in everyone, but it is a very common side effect. And then finally, studies have shown us that patients really don't stay on medications for longer than a year, or at least the majority of patients end up either stopping their prescription or seeking other treatment options. So the problem that we face in our society right now is that most insurance companies do require you to at least try one oral medication, if not 2 or 3, before we can move on to the advanced therapies. So those advanced therapies include Botox, injections in the bladder, InterStim, which is a bladder pacemaker, and something called PTNS, or percutaneous tibial nerve stimulation. And I did a webinar a couple months ago on InterStim, but today's webinar, of course, is going to be primarily focused on Botox. So what is Botox? This is just the protein structure of the botulinum toxin. We know that Botox is used for cosmetics, and it's also used in different medical conditions, including excessive sweating. As I mentioned, it's botulinum toxin, which is a neurotoxic protein. It sounds very scary, but in very dilute concentrations, which is what we use it at in the office, it can be very, very helpful for different medical conditions. It basically it's a neuromuscular blocking agent, and it just prevents muscle contraction or spasm. It is produced by the bacteria Clostridium botulinum. This slide I included just to show you that we have known a lot about Botox for a very long time. Going back to the 1820s, they identified this toxin. The term botulism is coined from the Latin word botulus, or sausage, because it was a poison that they found in sausage. But basically, the effects of Botox have been studied, for the past 200 years. And in 1989, 1980, it was used to treat strabismus, which is a kind of like the lazy eye. So ophthalmologists would use it for that. It was also in 1989 FDA approved for the use of blepharospasm, or facial muscle spasms. In 2000, it was FDA approved for like torticollis, so where the muscles in the neck spasm. And then, of course, in 2002, it was FDA approved for cosmetic purposes for the glabellar lines and wrinkles on the face, and also for axillary hyperhidrosis, which is excessive sweating. So I think most people, when they think of Botox, they think of it as for the cosmetic purposes. And a lot of my patients say, well, while you're injecting it in my bladder, can you inject it in my face? And I do not actually do any cosmetic Botox. I actually went to a course to learn how to do it, but I'm busy enough with overactive bladder. So we've decided to not go down the Botox cosmetic route at this time. So again, these are the different treatments that Botox has been used for in medicine. And then as far as contraindications to Botox, a lot of people ask me, what if I'm allergic to it? Well, very, very few people, I personally haven't encountered maybe one patient in my practice, and I inject probably 200 patients a year with Botox. Maybe one patient over the past 6.5 years have I felt had some sort of sensitivity to Botox, but usually people do very well with it. If you are concerned, we do sometimes do little skin tests on the forearm to see if you have any kind of reaction to the Botox. So really, if you have any allergies to the components of the formulation, albumin, which is protein, which is unlikely, then we don't recommend it. But again, that's very far and few in between patients who I would ever say have a contraindication to Botox. And then, of course, if you have a severe bladder infection, we would usually delay your procedure until we treat you with antibiotics. So Botox for overactive bladder was approved by the FDA on January 18th, 2013. And that was kind of an exciting time in my career, because prior to this, all we had were medications. And like I said before, I wasn't too enthralled with medications. So this really gave us a nice new alternative for treatment. So how does Botox work? Certain chemicals travel from nerve cells to muscle cells to make the bladder contract so one can urinate. For people with overactive bladder, these muscles will often contract uncontrollably. So when we place Botox directly in the bladder muscle, it helps block those nerve signals that trigger overactive bladder. That doesn't mean that your bladder can't contract when you normally want it to contract to go to the bathroom, but it prevents those spasms when you don't want to go to the bathroom. So before treating you with Botox, we first have to get it approved by your insurance company. We provide information to the insurance company from the office, such as prior treatments that you've tried, what medications, behavioral modification, pelvic floor exercises, that sort of thing. Whatever qualifications your specific insurance company requires, we provide documentation that you have tried that. And most insurance plans, including Medicare and Medicaid, cover Botox treatments for overactive bladder. The company also provides basically some discounts for patients with private insurances. So if your private insurance doesn't cover it completely, usually we can get you some discounts so that you get reimbursed, or part of your treatment is covered outside of your insurance. So monetary reasons shouldn't preclude you from having the Botox procedure. So what to expect when you come in for your procedure? Basically, I complete the procedure, or one of the providers completes the procedure with support from a medical assistant. So there's usually at least 2 people in the room doing your procedure. It takes me about 3 to 5 minutes to inject the Botox, so not very long. Most patients describe the procedure as uncomfortable. Some particular pricks of the needle can be painful in certain areas, and we never really can predict what those are, but any discomfort subsides after the injections are received. So most people don't have discomfort after the procedure is over. And you can drive and return to your regular activities, including work, immediately. There's no sedation. Now, we can inject Botox in the operating room for certain cases and certain patients, but usually this is done in the office. So this is just a picture. Now, I don't usually wear full gown, gloves, mask. Well, I wear gloves, and now I'm wearing a mask, but usually not a surgical cap or gown in the office. But basically you can see the doctor or the provider is holding a cystoscope, which is a camera that goes into your urethra and then into your bladder. And while watching on the screen, we take a very tiny needle that looks humongous right there, but it's actually very, very, very tiny, into the bladder and inject the medicine into the bladder wall. And you can see the assistant is pushing the syringe, and gradually we inject little aliquots of Botox all along the bladder wall, as you can see here. This is another, the picture of just sort of as the needle goes in, we put it into the bladder wall. And once the needle is into the bladder wall, then we inject the medicine. And sometimes you have a little bit of bleeding from the little sites, as you can see here, but usually that's, actually that's, I'm not gonna say never, but never say never, but it's it would be extremely, extraordinarily rare to have any issues from the bleeding that sometimes is associated with the procedure. This is just a little video. Let me just play this for you here. So this is not me, actually. I wish I had videotaped one of mine before this webinar. This person seemed to be a little bit shaky, but usually it's a fairly smooth procedure. So you can see they put the needle. Now this, again, this is so tiny, you can barely see this needle tip. I mean, if I don't have my readers on, I can't see that needle tip. So it's very, very, very tiny. It just looks gigantic on the screen. So, and these blood vessels here are just like little capillaries. So it's very, 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 very small. But some people do feel the little pricks of the needle. So the question is, does Botox actually work? So the flat out answer for that is absolutely. This is one of my favorite treatments for patients because it does work so well. The majority of patients receiving Botox have at least a 50% reduction of daily leakage episodes. Many of these patients reduce their leakage episodes by 75%, and 1 out of 4 patients report leakage episodes stopped completely. So that is a very large proportion of patients that are completely cured with the Botox. Now, when I did the air quotes for cured because Botox doesn't last forever. So we have to repeat the injections. It's not a one and done situation. This is just to show you the comparison between Botox and placebo. So after your first treatment, what happens next? Usually we have you follow up in our office in 6 weeks to discuss your results. Now, with COVID, we are giving patients the option of following up in person, by phone, or by video. And basically, we just want to check in and see how it worked for you. So for example, if you do not have the results you were hoping for, sometimes we have to actually increase the dose. So we usually start with 100 units. And if we need to go up, sometimes we'll go up to 150, 200, 250. The highest I've ever gone is 400 units. And I've usually done that for patients with neurologic conditions like multiple sclerosis. But usually we can accomplish it anywhere from 100 to 200 units. So I mentioned before that Botox doesn't last forever. So how long does it last? Botox works for up to 6 months, which is why retreatment is usually 2 times per year. Now, I have some patients that go as long as a year or longer, and I have some patients that have to have it every 3 months. But the majority of patients on average have it every 6 months. So if you come in January, we schedule you for July. Come in July, we schedule you for December or January. And when you do have your injection, you may not notice results right away. Botox does take some time to work. So you might not notice results for at least 2 weeks. If your overactive bladder symptoms return before 6 months, we often want you to contact us so we can retreat you sooner. But we do need a minimum of 90 days between treatments, and that's just an insurance thing. So are there any side effects? The most common side effects after Botox treatments are urinary tract infection. So you can get a urinary tract infection just from the procedure itself. So patients who are very, very prone to infections, sometimes we will give them antibiotic at the time of their procedure. We don't always do that. Sometimes patients will have painful or difficult urination for a couple days after the procedure. And then very rarely, patients will have the temporary difficulty emptying their bladder, which could require self-catheterization or a Foley catheter. I just want to emphasize how very, very uncommon this is. So I do have some patients where this has happened. I will tell you that I can count them probably on just two hands over the hundreds of patients that we have done Botox for. But even some of the patients that have had to straight cath or wear a catheter for a period of time, those patients still, the majority of them still wanted to do the Botox again, because once the Botox kicked in and the voiding function normalized after a couple of weeks, they felt like it helped them so much it was worth it. Most patients do not experience the above side effects and find tremendous relief from this treatment. So in conclusion, Botox is a highly effective treatment for overactive bladder. It is a quick in-office procedure with very few side effects. It's covered by insurance and more cost-effective usually than medications in most instances. I wanted to point out that earlier this month, I did release my 4th episode of my podcast, Girl Problems, and this one is on Botox for the treatment of overactive bladder. If you haven't listened to my podcast yet, please do. The reason that I'm doing the podcast is because patients tell me the same things over and over and over again, and then I'm repeating them to my other patients, but I kind of wanted patients to hear from other patients. So my podcast, I do recordings often from patients of mine, and they talk about their experiences with Botox, their experiences with overactive bladder, prolapse, vaginal atrophy. So please tune in to my podcast. It's available on multiple platforms, including Google Podcast, Apple Podcast, Spotify, and a few others. And it's also on my website. And then if you have any questions regarding the use of Botox to treat overactive bladder, you can always call our office or go to our website. So I wanted to just start off with, let me see if I can pull up. Okay, let me see here. I wanted to just pull up these questions that I have from one of my patients who I believe is on the line right now. So the first question was, in your experience, what is the percentage of your patients that need to self-catheterize after treatment? I sort of talked about that a little bit in the presentation. I would say, again, very, very rarely. It's very uncommon for people to have to self-catheterize. And in patients who aren't able to self-catheterize, we can place a Foley catheter temporarily. And that is usually less than a month, maybe even just a couple of weeks. The second question from this patient, and I see that there is a person wanting to ask a question, so I will get to you soon. The second question is, how common are the side effects of itching and trouble swallowing? Itching, I haven't had anybody complain of in particular that I'm aware of related to the Botox. I have had one patient over the course of the past 6.5 years or even longer, because I started doing this. I've been doing this actually since fellowship, because the fellowship location that I was at was one of the study sites. So I've been doing this since 2005. And I would say that there's only one person I can remember who had trouble with swallowing. And then it says, as an elderly patient who had COVID in late November, do you have any thoughts on the timing of this treatment post-COVID? What thoughts can you share on the timing of treatment and receiving the COVID vaccine? So I don't think the two are related. For elderly patients, obviously we're always concerned about patients coming out in public. We try to be very, very careful in the office by keeping the foot traffic low and crowds low, so that when people come in, they're not interacting with a whole lot of other people. So just from the pure standpoint of trying to keep you safe from COVID in our office, we're trying to do a very good job of that. But related to the Botox in particular, I don't think either I don't think the Botox would have an impact. I can't think of a scientific reason or a pathophysiologic reason why Botox would be a problem in a post-COVID patient or in relationship with the timing to the vaccine. So I hope that helps. I'm going to now move on to somebody who wants to ask a question. I'm going to click this allow to talk button. We'll see if this works. All right, go ahead. I think you need to.
Hi. Yeah, just asking if you can have Botox after you've already had sling surgery for stress incontinence.
Absolutely, yes. That's a very good question. And they're two totally unrelated conditions, honestly. The sling is for stress incontinence, obviously, as you mentioned, and the Botox is for overactive bladder, but I do simultaneous slings and Botox on people all the time. So that is absolutely permitted. Yep.
Great. I have another question too.
Sure.
I have an elderly mother-in-law who has interest, and is there any age limit to somebody having Botox treatment for OAB?
Nope, not at all. As a matter of fact, if you do end up listening to my Botox podcast, one of my patients is 94 years old. So,
well,
and she talks on the podcast. So we take all comers, all ages.
Great. Thank you so much.
You're welcome. You're welcome. Okay. Let me see here. Does anybody else have any other questions? Let me see if I'm looking in the right spot. Okay. All right. One more little button that's okay. There's a chat. Let me see. Oh, I see the chat question. Okay. Are there any other questions? Don't be shy. You can type them in actually. If you don't want to ask them out loud, there's a question and answer thing. And I only the hosts and the panelists can see the questions. So if you wanted to type in a question, you can do that. I'll just give you a couple more minutes, but I would just like to say that I don't know what I did there. I do think this is a great treatment option. So for anybody interested, definitely let me know. All right. Well, thank you all very much and have a great night.